Radiology for 6th semester students of the Faculty of Medicine, Radiology. Radiology in Semester 6 focuses on the understanding of medical imaging technologies used for diagnosis and treatment of diseases. Here is a detailed and structured explanation of the radiology topics that will be studied. 1. Introduction to Radiology. Definition of radiology. Radiology is a branch of medicine that utilizes imaging technologies to diagnose and treat various medical conditions. Purpose of radiology. It helps in diagnosing diseases by visualizing the body's structure using X-rays, CT scans, MRI, ultrasound, and other imaging techniques. Non-invasive imaging. Radiology enables diagnosis without the need for invasive surgical procedures. 2. Types of radiological imaging. X-ray. Working principle. X-rays are directed through the body and absorbed by detectors to create images. Applications. Imaging of bones, fractures, lung infections, and tumors. Advantages. Fast, cost-effective, and effective for bone abnormalities. Limitations. Does not provide detailed images of soft tissues. CT scan, computed tomography, working principle. Uses X-rays to produce cross-sectional images of the body at different angles, which are processed into 3D images. Applications. Head trauma, abdominal, chest, and vascular imaging. Advantages. Provides more detailed images than regular X-rays and is faster. Limitations. Higher radiation exposure compared to regular X-rays. MRI, magnetic resonance imaging, working principle. Uses magnetic fields and radio waves to generate detailed images of organs and tissues. Applications. Soft tissue imaging like brain, heart, spine, and joints. Advantages. No radiation and high-quality soft tissue imaging. Limitations. Expensive and takes longer to perform. Ultrasound. Working principle. Uses high-frequency sound waves to create images of organs inside the body. Applications. Imaging of the heart, abdomen, kidneys, liver, and pregnancy. Advantages. No radiation, inexpensive, and can be performed at the bedside. Limitations. Image quality may be poor in patients with excess body fat or gas in the abdomen. Mammography. Working principle. Uses low-dose X-rays to examine breast tissue. Applications. Early detection of breast cancer. Advantages. Sensitive for detecting breast cancer in asymptomatic women. Limitations. Cannot detect all types of breast cancer and may produce false positives. 3. Indications for radiological imaging. Disease diagnosis. Identifying the location and nature of abnormalities in the body, such as fractures, tumors, or infections. Monitoring disease progression. using imaging to track the progression of conditions like cancer or heart disease. Therapy planning and monitoring, using imaging for treatment planning and monitoring responses to therapy. Emergency imaging, in emergencies, such as trauma or internal bleeding, imaging helps for quick diagnosis. 4. Radiology safety principles, radiation and safety. Radiation use must be controlled to minimize excessive exposure. Protective techniques such as lead aprons and thyroid shields are used to reduce radiation exposure to patients and medical staff. Dose management. Radiation doses are calculated and controlled based on the type of imaging performed. Long-term risks. Prolonged radiation exposure can increase the risk of cancer and genetic mutations. Contraindications and considerations. Pregnancy. X-rays and CT scans should be avoided in pregnant women due to potential risks to the fetus. Patients with metal implants or pacemakers. MRI can be affected by metal objects. 5. Special techniques and procedures in radiology. Contrast imaging. Contrast agents are used to enhance the visibility of certain structures like blood vessels or the gastrointestinal tract. Examples include using contrast for CT scans or MRIs. Types of contrast. Iodine-based contrast, for CT scans and angiography. Gadolinium-based contrast, for MRI. Contrast procedures. Contrast may be administered via intravenous injection, orally, or via an enema depending on the examination. Angiography, a radiological procedure used to visualize blood vessels with X-rays and contrast. Applications. Assessing conditions of blood vessels like aneurysms, blockages, or vascular malformations. Fluoroscopy, a type of X-ray imaging that allows real-time visualization of moving structures within the body, often used in medical procedures like catheter placement or monitoring the gastrointestinal tract. Applications. Imaging the gastrointestinal tract, e.g., barium swallow, barium enema, and interventional procedures. 6. Radiology image interpretation, X-ray imaging. Reading X-ray images requires knowledge of human anatomy and understanding of possible abnormalities. Common findings: fractures, pneumonia, or cysts. CT and MRI imaging requires deep knowledge of body structures and how to process 3D images. Common findings: brain tumors, vascular aneurysms, or liver diseases. Ultrasound imaging. Images are obtained by scanning the body directly, and results can be viewed in real time. Common findings: pregnancy, benign tumors, or kidney stones. Mammography imaging. Mammography is used to detect small changes in breast tissue, including masses or calcifications. Common findings: lumps or calcifications suspicious for cancer. 7. Recent developments in radiology. AI-based imaging. Artificial intelligence is being applied in radiology to assist in image analysis, such as detecting tumors or organ abnormalities faster and more accurately. Molecular imaging. Imaging involving the use of contrast agents that target specific cells to detect cancer or infections. 3D and 4D imaging, the latest imaging technologies that provide deeper, three-dimensional visualizations in body structure monitoring. 8. Radiology case studies. Case 1. A patient with head trauma, examination. CT scan to assess brain injury or intracranial bleeding. Case 2. A patient with abdominal pain, examination. Ultrasound to evaluate possible gallstones or appendicitis. Case 3. A patient with chest pain, examination. Chest X-ray to assess pneumonia. Rib fractures or pneumothorax. Conclusion. Radiology in Semester 6 focuses on understanding imaging technologies used to diagnose and monitor various medical conditions. In-depth knowledge of imaging procedures, image interpretation, and patient safety principles are essential for practice in this field.